Vitamin B12, one of the most common deficiencies I've seen over the past several decades of practice. Today we're going to be talking about what it does, why it's important, who benefits from taking it, how you can get it tested at your doctor's office, and so much more. Stay tuned, we'll be right back. You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's zone. We got a show for you tonight. We're going to be talking all about vitamin B12, all the symptoms, side effects, disease associations. We're going to be talking about lab testing. We're going to be talking about which kinds of supplements can create side effects, which kinds you might want to look at taking and how much. And I've got a special treat for you at the very end, so stay with me. We're going to be talking about B12's role in something that's on everyone's mind. So let's dive in. If you're new to the show, the way this works, chime in with your questions. I'm going to do my best to get those questions answered before the show ends this evening, but it is a first come, first served basis. So welcome to the show. Let's dive into vitamin B12. Now, we're going to start with symptoms. And so what we're looking at here in this diagram, what you can see here, are some of the classic, some of the major symptoms that we see. So you've got here anemia. Now, with anemia, there are different kinds of anemia that can occur, but the most common, most well-referenced is something called megaloblastic anemia. What does that mean? The anemia component is, let's draw a different color here. So inside your long bones, you have bone marrow, and inside that marrow, you have what's called stem cells. These stem cells are precursors, if you will, to forming red blood cells, RBCs. Okay, so when we're talking about anemia, generally we're talking about red blood cells in particular, but a megaloblastic anemia is when your red blood cells are first born, they're born very large, and as they mature, they get smaller, and as they continue to mature, they lose their nucleus, and they take on hemoglobin, and they become discoid in shape. So that discoid shape, if you ever studied biology in high school, it's that divot in the red blood cell, that discoid divot that carries oxygen and carbon dioxide through the bloodstream. And so this maturation process is an important part of how a red blood cell evolves into a normal functioning red blood cell. So what happens here is you've got vitamin B12 is necessary for the stem cells to generate red blood cells. It's also necessary for the maturation process. So you got B12 playing a role in both of these areas, and this is why we call it megaloblastic. Mega means big, so the cells get stuck in this size, and when they're stuck here and they don't evolve to carry oxygen very well, then we have red blood cells, but we don't have the capacity to carry the oxygen. Think of these cells, these bigger cells, as clumsy and unable to do the job. And that's where anemia oftentimes can come from. And this is different than iron deficiency anemia that so many relate to celiac disease. So if you've paid attention to me for the last few weeks, we talked about iron as being a common deficiency in those with gluten sensitivity. As a matter of fact, iron deficiency is number one, okay, in people with gluten sensitivity. B12, in my experience and research, is number two. So think of it like this. The top two deficiencies that gluten can cause, we'll talk about how in just a minute, are iron and B12 deficiency. Both cause anemia, but B12 deficiency causes a different kind of anemia than an iron deficiency anemia. An iron deficiency causes a small cell anemia. So if we kind of expand this out, this red blood cell is even smaller, okay? And we call that microcytic anemia, microcytic hypochromic, meaning it's a small and a pale red blood cell. and it doesn't carry oxygen very well either. But they look very, very different on blood tests. They're obviously very different causes. But sometimes people with gluten issues have both iron and B12 deficiency. So there's a mixed bag, and their blood tests aren't always 100% accurate, which is why it's so important to measure these nutrients appropriately. And I'll get into how to measure B12 before we wrap up tonight around B12. Now, in addition, so aside from the anemia, we can also, it doesn't just have to be a red blood cell anemia. B12 deficiency can also stimulate white blood cells. And so some people develop low white counts, and that's important. Why? Especially if you're trying to fight colds and flus. This time of the year, as we go into cold and flu season, you want your immune system to be strong. Well, B12 deficiency can cause a lowered white count. It can also cause a lowered platelet count. So again, B12 can affect, because it affects the stem cells in the marrow and their development into red blood cells, white blood cells, and platelets. It can affect all three. Now, let's make some room here. B12 can also contribute to depression. It's actually one of the top causes of depression that I have seen clinically when people come in. A lot of times when we're looking at their nutritional status, depression is just a side effect that they have. We're measuring their nutrients, and we find vitamin B12 deficiency quite common in cases of depression. And there are a lot of reasons why. A couple of different chemicals that B12 is important for. One of them is homocysteine. Homocysteine elevation, so too much homocysteine, which can be caused by vitamin B12 deficiency, can be neurotoxic. So it can damage the brain, it can damage nerve cells, and this is one of the reasons why we'll sometimes see people form depression. But B12 also is important for the production of the myelin sheath in your nerves, which is the insulation around your nerves. And so for these main reasons, we'll see depression develop. Remember, depression is generally, it's a neurological problem. So these two, the depression and the neuropathy, so we can get, and really even when we look at dementia, there's some of the earlier research is showing the connection between homocysteine and dementia, or memory or cognitive decline, as well as myelin sheath disturbances. And so again, these all three, kind of think of these more specifically as neurological types of problems. Now, this is super common. A lot of people don't realize they go to the doctor, they got numbness and tingling in their hands or feet. And most people, when they have those types of symptoms, they're thinking, oh, I have a problem with my hand or my feet directly, like a physical problem, like physical trauma. Some people are told they have like herniated discs. And it's not to say that you can't have a physical impingement on a nerve, because there's carpal tunnel syndrome, there's cubital tunnel syndrome, there's all different types of nerve impingement syndromes that can cause neuropathy. But in my experience, it's very, very common for B12 deficiency to be overlooked. And so if you've got numbness, tingling, temperature sensation changes in your hands, feet, your periphery, and you don't know why, and there was no trauma, you never injured your back or neck, think vitamin B12. If you have something called ascending neuropathy, and so let me delineate what that is. Ascending neuropathy means the nerve damage starts in either the toes or the fingers, and it moves its way up. Instead of starting from the spine and moving its way out and down, it starts from the extremity and moves its way up. And generally, this is in the feet. When it moves up the leg into the pelvis region, that's called an ascending neuropathy. And this is almost always, in my experience anyway, a B vitamin deficiency, particularly vitamin B12. So if you've got a neuropathy, just keep this in mind, that ascending neuropathy. I've seen cases where doctors were looking and trying, they were doing CT images of the spine, they were doing MRIs of the spine, trying to find damage to the spine itself that's leading to that neuropathy. But when the neuropathy starts from the bottom and works its way up, generally it's, again, I want you to just emphasize, usually it's B12 contributing to that problem. Then we come down to some of these other symptoms. Joint pain. Joint pain is actually quite commonly caused, joint and muscle pain both. Let's make some more room. When you're low in B12, what happens, generally speaking, is your muscles, let me spell that out just for the sake of doing it. So your muscles have depleted O2 levels. They can't get adequate oxygen. One of the reasons this happens, it starts with the anemia. So the anemia itself creates the joint and muscle pain because of a lack of oxygen. Remember what happens when your muscles don't get adequate oxygen. They have to, if you guys ever worked out in the gym, you've ever heard anybody talk about aerobic exercise versus anaerobic. As a matter of fact, I'll give away a free copy of No Grain, No Pain to the first person who understands the difference between aerobic and anaerobic. So whoever we got in the feed that answers that question first, who knows that difference, we're going to give you a free copy of No Grain, No Pain. And Mel will clock that for us. So what happens in your muscle is there's two kinds of metabolism. So right, your muscle can generate energy either one of these ways, through anaerobic or through aerobic metabolism. If you do it with aerobic metabolism, in essence, if your muscle's working from this mode of operandi, you get energy without pain. If your muscle's generating anaerobically, then you get less energy because it's not an efficient way to generate energy with pain. Do we got any answers on that question yet?
No, we got one on YouTube.
Okay, it looks like we got one. Okay, so we got a right answer. It looks like, I don't know what the call sign, Jyan, Jyan, is that the right one? Is that
correct?
Yeah, so he wins, or she wins, I don't know. But aerobic means with oxygen, anaerobic means without oxygen, and so what happens is when you don't have oxygen, as in the case of an anemia caused by B12 deficiency, your muscles don't have enough oxygen to generate energy, so they generate energy less efficiently, and with that comes pain. The pain of what? Of lactic acid. This is a normal metabolic waste product when our muscles are trying to generate energy and don't have adequate oxygen, and so this begins to hurt. So if you've ever worked out and you were doing some exercise and the muscle started to burn so bad that you had to stop, that's common. It's why people stop lifting the weight, right? Because it hurts and it burns so bad. Well, that's lactic acid doing that, and then you have to rest and allow for that oxygen to recover in the muscle, and then that pain will slowly start to go away. Now imagine you're making lactic acid all the time because you're just chronically anemic and you don't have enough oxygen ever, and so your muscles, even walking up the stairs creates pain, or walking across the kitchen, or just, bending over to put your shoes on, you're using your muscle, but there's so little oxygen for your muscles to generate energy. You're chronically generating this substance that creates this low level of pain that you're always in. And that's one of the reasons why joint muscle pain are common manifestations of long-term vitamin B12 deficiency. We also get lethargy or brain fog, right, which goes hand in hand with this, but also, it has to do with this. So a lot of the symptoms of B12 deficiency have to do with the fact that low B12 creates anemia that then leads to other types of problems. So anemia is like the lead domino. Once that domino falls, it cascades and a bunch of other symptoms follow. But brain fog and lethargy, very, very common. Hair loss is a common symptom of vitamin B12 deficiency. And really, one of the big reasons why is because B12 deficiency oftentimes is associated with protein deficiency, because where we get most of our B12 comes from protein, and so we'll see this especially true in people who are following vegetarian diets, and we'll get into that in a minute. But they're maybe not getting adequate protein, and again, with that lack of protein comes a lack of B12 food sources, and so we get this hair loss. Remember, your hair is protein. We'll also see on the tongue, we'll see the tongue develop swelling. That's what glossitis means. It's a redness or swelling of the tongue. So the tongue becomes kind of bulbous and bigger. And I'll see sometimes people will start to develop, their tongue gets so thick, they'll develop sleep apnea, and their doctor will tell them you have sleep apnea because of swelling in the throat. But really what can happen is this tongue can get really, really big and it can block the airway. And so these are all symptoms of vitamin B12 deficiency. In my experience, probably some of the most common and the most subtle, like the ones that develop early on. The first one is really brain fog, is super, super common. And I asked a question, I asked a poll, and those of you who come in and haven't answered it yet, but I think where are we at in our poll right now? We've got over 100 answers in the poll, and I asked the question is, do you struggle with brain fog most days? And so far, 56% of you say yes, that you struggle with brain fog. We'll cap that out at the end, but that's so far, we're just 100 votes in or so. So again, one of the other symptoms of B12 deficiency that I wanted to point out tonight, because a lot of you are struggling with this one, we'll pull this research study up. You won't hear this stuff anywhere else. I'm the first. Oh, where'd it go? Let's just move it down, and there we go, right here. So this study on vitamin B12, the effect of vitamin B12 deficiency on olfactory function. This is your sense of smell. So olfactory is smell. And so a lot of you don't have your sense of smell right now. If you've developed, especially if you've developed colds or the disease that shall not be named, here's what I wanted to point out to you. So vitamin B12 affects the sense of smell. In this research study, these researchers showed for the first time that olfactory dysfunction, meaning loss of sense of smell, may be present in patients with vitamin B12 deficiency. Keep that in mind as another symptom as we move through the show tonight. I'm going to, at the very end, I've got kind of some special research for you that I'm going to show you. So just keep that in mind as we move through. All right, let's talk about B12 absorption. I think it's important, before we talk about what causes vitamin B12 deficiency, it's important for you to understand how B12 is actually absorbed. So most of the B12 in the diet comes from meat or animal products. And so, if we're talking about meat, I mean, again, some of you are vegetarian, some of you might be vegan. And if you are a vegan, I would highly encourage you to supplement with vitamin B12. And we'll talk about why here in just a second. But so this could be meat, but dairy also contains B12, as do eggs. And so some of you may be lacto-ovo-vegetarian, in which case the dairy and the egg has good quantity of B12. There are some plant sources of B12, but they don't add adequate quantities of B12 robust enough in the diet to prevent a major deficiency developing over time. So you got to keep that in mind. So in this diagram here, I've got meat coming into the stomach. And one of the things that happens when you have that meat there, let's change our color here, is you have these parietal cells that line the stomach, okay? And these parietal cells, they do a couple different things. They produce hydrochloric acid, and they produce intrinsic factor, or IF, okay? Intrinsic factor and hydrochloric acid. Why is this important? Because the acid breaks the vitamin B12 off of the meat. It cleaves it, if you will. So it breaks B12 off the meat. Now you got B12 floating around in the stomach. And then you have intrinsic factor, wraps B12 like a taxi cab and takes it down into your small intestine. It shuttles it down the length of your intestine to the distal small intestine where vitamin B12 is absorbed. And so if you understand that, you understand that two things just from this diagram, right? Actually three. One, you've got to have a source of animal-based food in the diet to obtain adequate B12 if you're not going to supplement. Number two, hydrochloric acid. In other words, your stomach has to be producing adequate quantities of acid or it becomes more challenging for you to get the B12 off of that animal product. And then number three, the intrinsic factor has to be able to bind that B12 to carry it. It's how it gets into your bloodstream. So those three things really generally need to be present in order to be effective at absorbing B12 properly. Now, I've got this image I'm going to pull up for you as well. So, some people have talked about that, in humans that you can produce, the bacteria that live in your intestine can actually produce vitamin B12, and that's true. Your bacteria can produce vitamin B12. Here's the problem. So if you look here, we've got the stomach, we've got the small intestine, and then we've got the colon or the large intestine. Well, the bacteria that produces B12 largely is inhabiting your colon. And remember what we said earlier, this is why it's so important to understand why and where B12 is absorbed. It's absorbed in the area of the small intestine called the ileum. The distal ileum, which is the section right before you get to the colon. This is where your B12 goes in. That's what these arrows are representing. They're representing, if you look at the diagram over here, this little half moon blue structure, that's intrinsic factor. That's what we were talking about a minute ago. And then the little red circle, that's B12. So what happens, you see it up here, intrinsic factor is produced in the stomach. It attaches to B12. It shuttles it through your small intestine until we get to the very end of the small intestine, where it then is absorbed into the bloodstream. The bacteria in the colon can produce vitamin B12, and that's what you're seeing here. These pill structures, these green pill structures, are producing cobalamin, that red circle there. But by the time you're here, there's very little absorption of B12 that can occur. So basically what you're doing is the bacteria in your colon are making B12 that then you poop out. And so you're going to have B12 in your poop, but you're not going to have B12 in your bloodstream if you're relying solely on these bacteria to help you produce your B12. So again, very, very important. I just want to emphasize that because I know that some of you, and maybe many of you, are following a vegetarian diet, which I think is perfectly fine and safe and healthy for some of you. But you want to be aware of that, because if you're not getting adequate protein from animals, your liver has about 1.5 to 2 years of B12 in it. And that's from the day you go strict vegetarian. So your liver has this ability to store B12, and for most people it's got about 1.5 to 2 years storage. So a lot of times, and this reason I say it is because a lot of you go vegetarian or go vegan and you feel better, and so you're equating that diet change to you doing better, and you're not wrong, but you get a couple of years into this and your B12 storage starts to run low, and then you can start to develop the brain fog, the lethargy, the fatigue. And I just want to pre-warn anybody who's wanting to be on that plant-based diet to make sure that you supplement. So this is where it's really important to supplement, in my opinion. As some people will say, yeah, but there are certain types of foods that are plant-based, certain types of algae and things of that nature where you can get B12. The problem with those types of foods, nori and algae, etc., you can't eat enough of those things to get the quantity of B12 to sustain you. There are certain mushrooms as well, like shiitake, but to get enough B12 from shiitake, I mean, you've got to really wolf it down. You'd have to be eating, massive quantities at every one of your meals. And it's just, arguably, it's not all that practical for the average person. So again, this is where supplementation can be very, very critical. Now, gluten is another major cause of vitamin B12 deficiency. You heard me mention a minute ago that gluten, we know that gluten is one of the major contributing factors to B12 deficiency, and I'm going to pull this up and show you why. Actually, let's just erase this section and draw on it again. So if we look at here, one of the things that gluten does is it damages parietal cells. And so what that means is that will reduce your body's capacity to generate acid. Right? So when you have gluten damaging your parietal cells directly, it can cause lowered acid production. We also know that gluten can cause an autoimmune condition. There's an autoimmune type of anemia called pernicious anemia, which affects your production of intrinsic factor, and that's another thing that gluten has been associated with, is the triggering of a pernicious anemia. But then the last thing that we know, going back to this other diagram here, let's just pull that up, is that gluten also damages this area of the small intestine. So this is a common area that gluten can damage, is that distal ileum. So some people, where they're getting their gluten atrophy, where they're getting their gluten damage, is in this area where vitamin B12 is absorbed. So from a gluten, this is one of the reasons why B12 is so commonly associated with gluten sensitivity, because gluten causes intrinsic factor autoimmunity potentially. Gluten can damage your ability to produce acid, and gluten can actually damage the distal small intestine. Now, it's also been shown that gluten causes a form of gastritis, so it damages, aside from just damaging the parietal cells, it can damage the lining of the stomach, leading to other problems as well. But, you know, this is one of the big reasons why we see gluten contributing to vitamin B12 deficiency. So gluten sensitivity, diets that are low in animal protein. We get this a lot. People that take massive quantities of antacids. So, you know, you pop the Tums, the Rolaids, or whatever brand, the H2 antagonists, or the histamine blockers, or the PPIs, the proton pump inhibitors. So these are, you know, some of these are over the counter and some of these are prescription, but it's very common. You have heartburn, right? What's the common scenario is you get heartburn, you visit the doctor doesn't really do much testing. They just assume that you have acid reflux because you are experiencing heartburn, and they give you an antacid. You have to understand that you can have the symptoms of what feels like acid reflux when you don't make enough acid. So it's not just too much acid being produced, which is the common kind of theme, again, when you go visit a doctor. It's oftentimes that you have the symptoms of reflux because you don't produce enough stomach acid, and so when you eat food, it sits inside of you and it starts to rot and form putrefaction byproducts. These byproducts can be irritants to the GI tract, creating what feels like reflux. And so if your doctor doesn't differentiate that, they put you on an antacid, they can actually make the problem worse over time. We also have antibiotic use. We know that chronic antibiotic use especially can contribute to vitamin B12 deficiency. But what's also interesting here is because, well, we won't get into that, it's too complicated. And we know estrogen, so like women, ladies, if you're taking long history of BCP, birth control pills, or ladies that are older, if you're using estrogens for menopause symptoms like hot flashes and things of that nature, you've got to watch out because estrogens can deplete your vitamin B12. We know that drugs for seizures, like anticonvulsant medication, so if you've been diagnosed with epilepsy or seizure disorder, those particular classes of medications are known causes of vitamin B12 deficiency. We also know that people going through cancer treatments, getting chemotherapeutic agents, that also can cause vitamin B12 deficiency. So these are some of the biggest triggers that we'll see in kind of real world application in today's modern world. So again, your diet could be too low. You could be damaging your intestines by eating gluten. Other food allergies can also do this. Gluten is not the only thing that food-wise that can damage the GI tract, and the number of different medications. Medications, in my opinion, probably one of the biggest causes of nutritional deficiency, period, and being that inclusive of B12. So these are some gluten and grain-free foods rich in vitamin B12. Now, I didn't list on here, I didn't list dairy, but we could list dairy on here. Because dairy does contain, so if you're trying to, again, eat more plant-based, if you're gonna use dairy, I said this before, but the problem with a lot of dairy today is A1 casein. A1 casein can mimic gluten. So a lot of the dairy products out there can create gluten-like problems. If you're getting A2 casein or A2 milk, then the biggest thing you got to want to watch out for is make sure it's organic and that it's hormone-free. One of the problems, again, with dairy in general, aside from the mimicking, is what is added to the dairy. A lot of the processed dairy today, you've got other gums and other additives, things like tissue transglutaminase, but microbial transglutaminase or meat glue, which is added oftentimes to dairy. So dairy can be problematic, and we have to understand that many people are allergic to dairy. And if they're not allergic to dairy, with gluten sensitivity, one of the side effects of gluten sensitivity is something called lactose intolerance. It's not the same thing as dairy allergy. Intolerance means you lack the enzymes that digest lactose, which is the sugar found in dairy. And when you can't break that down, it causes a lot of gas and intestinal bloating and makes life very, very painful when you're eating dairy. So lactose intolerance is a side effect oftentimes of gluten-induced damage, because gluten damages the intestinal cells. Those cells produce lactase, the enzyme that helps you break down lactose. And so many people that have gluten issues over time, they start to develop dairy issues because of the intolerance. So again, you got to be cautious with dairy, although yes, it does contain B12, but these are your other sources. You could add, again, I mentioned shiitake mushroom earlier, you could add that too, but it's not a great source. It's a poor source of vitamin B12. So I wouldn't suggest anyone just try to get all of their B12 from that food source by itself. Let's talk about some lab testing next. So there's a lot of debate in this area, and so we're just going to talk about some different things, some more basic that any doctor can run, and some a little bit more complex. We're missing something here. So MCV and MCH. So MCV, MCH tests, this stands for mean corpuscular volume and mean corpuscular hemoglobin, but a lot of times these tests will come back and they'll be too high. So your markers on your blood test, this is a basic blood test that any doctor can run on what's called a CBC, a complete blood count. So if they're running a complete blood count test, these are two values that come back. Oftentimes with B12 deficiency, these markers will come back high. And remember what this means. So I showed you earlier that, let's change colors. I showed you earlier that, that when the red blood cells are born, they're born very large. Right, we call that megaloblastic anemia. So they're born very large and they have to mature and get smaller, and then eventually they form kind of that biconcave disc that looks like a red blood cell. Well, an MCV, MCH value means your cells are too big, mean corpuscular volume. So it's the volume inside the corpuscle. Corpuscle is a red blood cell. So that's the fancy language over here. That's the kind of the translation, if you will. But if you've got large, then you're going to have high MCV, MCH. So this can mean that you have a B12 deficiency. But I want to be cautious because you might have done this and you know you have an elevation in your MCV and you've taken B12 and your MCV stays elevated even though you've taken B12 for a long time. B12 deficiency is not the only thing that can cause elevation in MCV and MCH. So these tests, although can be helpful, aren't definitive. So you can't rely on them all by themselves. And that's important because if you're asking your doctor to check your B12, you don't want to just look at these tests. Now there's also a test called a homocysteine test. And I mentioned this one a minute ago. Homocysteine is a natural byproduct of cell metabolism. So our cells naturally produce homocysteine. And one of the things that happens is homocysteine is converted into a substance called methionine. And so what happens to make methionine from homocysteine requires B12. And so if you don't have adequate B12, you cannot convert homocysteine into methionine, and so homocysteine will elevate. So this is another one. High levels of homocysteine, generally, on a lab test, it's something higher than 9. If it's above 9, that's generally too high. Sometimes I get people in their 30s, which is quite high, but homocysteine elevation can be a sign, a lab marker, if you will, of the potential for a B12 deficiency. But just like MCV elevations can also be B12, but can be other things, so too can homocysteine. So homocysteine being elevated is not explicitly caused by a B12 deficiency, although again, it can cause it, it's not always exact. Another test is called an MMA test or methylmalonic acid test. This test can be high, would also indicate a vitamin B12 deficiency. So these are two that most of your doctors know about or should know about. I would hope they would know about them. They're pretty common. And so these are things you can ask for that generally insurance covers. So if you're going in and your doctor is not an expert or she's not an expert in nutrition and you're just kind of like trying to put some things together, you can ask for these tests. Although my advice is if your doctor doesn't know anything about nutrition, you shouldn't be going to that doctor to try to figure nutrition out. Like you don't want to be the guinea pig for their lack of experience. But at the same time, I want to give you this information so that you have the ability to ask about it. Now, some people and some doctors will measure something called a serum B12. And a serum B12 test is really, in my opinion, is a very poor way to assess. It's very poor to try to assess B12. And one of the reasons why, there's a process in the body called redistribution. So remember when I said earlier that your liver your liver stores about 1.5 to 2 years of extra B12, rainy day B12, if you will. And so what happens is when the serum levels drop, the liver pushes out B12 into the bloodstream. This is called redistribution. The liver registers that low B12 in the serum. It pushes B12 into the serum. If I'm a doctor measuring your serum levels, I might be catching that your levels look normal because your liver is pumping extra B12 out into the bloodstream. And if I'm running your lab test as that's happening, we're going to get a false normal. We're going to get a serum lab test that is not all that accurate. So you got to be very cautious about serum B12. Now, if your serum B12 is low, you definitely do have a problem. So you say, this test is okay if it comes back low, but if it comes back normal, it doesn't mean you don't have a vitamin B12 deficiency. So it's very important that you understand that. And the best way, in my opinion, the best way to come and look at B12 is something called intracellular testing. It's where you actually look inside the cell with a stimulator. So there's a technology that we use in clinic where we'll actually radio label your DNA inside your cells with something called thymidine and measure the growth rate of the cell. And when we do that, we can then challenge the cell with or without nutrients to see what nutrients it's storing adequate quantities of. That is the best way to analyze a vitamin B12 deficiency. So very, very important. So that you're not relying on that serum. Now let's check out some of the different forms. I know that's going to be some of the questions that we get tonight. There's different forms of B12. There's cobalamin, which is what B12 is. But then there are certain things that are attached to cobalamin, or B12, okay? And one of them is cyano. So if you ever see the term cyanocobalamin, that's a form of B12. It's poorly absorbed. And it's poorly bioavailable. So once you do absorb it, your body has to convert it into adenosylcobalamin and other forms of cobalamin B12. And so if you're deficient in other nutrients, this process of conversion doesn't happen very well. So cyano is kind of on the low list. It's a poor, I don't recommend it. It's poorly absorbed and it's just not a great form. The reason why you're going to see this in so many supplements will contain the cyanocobalamin is because it's super cheap. And so a lot of your supplement manufacturers they're going to lean into the fact that most of you are probably ignorant about the differences of B12. Now, not all of you are. I know some of you are really smart, but a lot of you don't know these differences, so I'm teaching them. And if you never heard of this before, and now you start looking at supplements, if that supplement contains cyanocobalamin, you know what you're doing is you're buying a product that's really cheap, it's poorly absorbable, and it's not going to work very well to correct a deficiency. I see this happen a lot with the injections. A lot of doctors will use cyanocobalamin as an injectable of B12, and they're using the worst form, and they don't get great correction with those poorly bioavailable forms. So cyanocobalamin is not great. You also have another form called adenosyl, which is better than cyanocobalamin. And then you have hydroxy, which is what the body is natural form. The natural form found in the body is hydroxy. And then you have the activated form, which is methylcobalamin. So these are the two I prefer, hands down. And why would we differ between hydroxy or methylcobalamin? For some people, methylcobalamin can cause anxiety. It's too strong. It's too bioavailable. It's too bioactive. It's going to become almost like a stimulant. It can cause irritation, agitation, irritability, and keep them awake at night. So if that's you, if you've ever taken B12 and it was methylcobalamin, you're probably going to do better on a hydroxycobalamin. It's a lot better tolerated by people that have B vitamin sensitivity. So hydroxy is a good brand, or a good form of B12, but generally inside the body it has to be converted into methylcobalamin. And so by taking it in this form, you just allow that to happen in your body, kind of a little bit slower of a process, so you don't tend to get ramped up or amped up. And so again, those of you, I saw that question I think a couple of times in the feed, why do I have agitation or irritability when I take vitamin B12 in the methylcobalamin form, this could be the potential reason why. So how much do you take when it comes to B12? It depends. I mean, if you're very deficient, if you're severely deficient, what we use in the practice is anything between 2,000 and 10,000 micrograms daily. That's a C. Micrograms daily, 2 to 10,000 micrograms daily, and it just depends on the individual. I mean, it's very, just know this, B12 is very safe. There's no known potential toxic doses. No one has ever died of B12 overdose, and so you're not going to most likely hurt yourself, although I wouldn't suggest you just randomly take 10,000 indefinitely without having some of these labs properly done where you can get a good idea for what's going on. But again, these are ranges that we'll commonly use with people to get good correction. The other thing to consider here is that some vitamins, aside from their forms, you know, B12 is absorbed, as I showed you, in the stomach and the small intestine. Those two areas are very important. Those two areas are also commonly damaged by gluten. So if you're there, if you've just gone gluten-free and these areas are damaged and you're trying to take like a B complex vitamin that has, you know, these forms of B12, you're probably not going to absorb it as well. That's one of the hallmarks of swallowing the pill if you're damaged. So one of the great things about B12 is you can do a sublingual. And what a sublingual will do is it will bypass your stomach and your intestine, and it will absorb through the mucosal tissue in your cheeks, through your buccal mucosa. So a sublingual, one of those lozenges that you just put in the mouth and let it dissolve, is going to absorb through your cheeks and bypass the damage of your stomach and small intestine. So this may be a better consideration if you're new to the gluten-free diet and you suspect that you've got a lot of years of damage in your stomach and small intestines where you might not be properly absorbing. It's just a more efficient way to get it absorbed. Okay. All right. Well, lastly, what I want to talk to you about tonight, a lot of you have lost your taste and smell. And so let's move some of this stuff out of the way. There's a lot of research going on right now in this industry. And one of the studies I showed you earlier was that vitamin B12 deficiency could affect olfactory nerve function. So it could create a loss of taste and smell. There's a lot of people right now, you know, with the disease that shall not be named, getting olfactory loss. In other words, their taste is very dramatically changed. They can't smell, they can't taste post-infection. We know that B12 can affect olfactory. So I wanted to show you some of the things that are being researched right now. These are new studies, they're newer studies. So you can see in this study, can vitamin B12 be an adjuvant to disease that shall not be named treatment? Okay, so we've got, in this particular study, what they're claiming or what they're saying is that it's possible to infer that this virus interferes with cobalamin metabolism or vitamin B12 metabolism. And the reason why is it causes a lot of oxidative stress and damage that can elevate homocysteine concentration, that can lead to problems with platelets, elevated chemicals in the blood that can pull or have an impact on vitamin B12. So the theory is that the symptoms or the problems associated with the illness can actually deplete your B12 and leave you wanting for B12. Okay, now, so that's one study here where these doctors are hypothesizing that B12 may be a key element that might be helpful for some individuals. Now, in this study, and this was just recently published as well, what you're seeing here is, you know, we've talked about cytokine storms in the past, the viral binding and invasion and adaptive immunity. This is what we all want right here. This is what everyone's after, is the ability to be able to produce healthy levels of antibodies, right? You got T cells and you got B cells. The B cells produce the antibodies. That's what these little things right here are. Those are antibodies that help bind onto viruses and prevent them from basically taking over. And one of the things that's necessary for these functions to work are your B cells. You also, though, or rather your B12 is necessary for your B cells to perform as well as your T cells. So B12 is also necessary for your T cells, which are natural killer cells, NKC. These natural killer cells can help you kill off bad guys. So again, these authors of this paper are theorizing, and they're not just stopping at B12, but they're talking about B1 up here with adaptive immunity. They're talking about B2 with viral replication, and B3, as well as the cytokine storm with B5 and B6, and hypercoagulability means clotting of the blood with B6 and B12. So you can see it's the family of B vitamins that they're basically saying these guys play a major role in host immune defense, how your body responds and adapts to the exposure. So these are all very important. Now let's say you get sick and you were deficient in these B vitamins before you got sick. That is one reason people get sick, is they have poor levels of nutrient status. In other words, their nutrient levels are low, they're poor, and then they're subjected to exposures, and their body can't handle it because all these very important functions need these key B vitamins in order to do those functions. So again, I'm just trying to illustrate that for you, because this last one here, and this isn't the only study, but I just want to show you this because, again, I know a lot of you are looking for what you can do to be as preventative as possible. So here's what they found, that vitamin D, DMB stands for vitamin D, magnesium, and B12. So vitamin D and B combination in older COVID-19 patients was associated with a significant reduction in proportion of patients with clinical deterioration requiring oxygen support and/or intensive care support. In other words, the combination of D, magnesium, and B12 led to better outcomes in these individuals. And I think it's important that you all have this knowledge so that you can make those decisions intelligently about what it is that you want to do, whether that's supplementation or making sure your diet is nailed in, dialed in, super tight so that you're getting adequate B12. But where I see a lot of people being affected right now is especially the ones that are low protein diets and animal or no animal meat, so purely vegan. I see a lot of vegans kind of teetering. Their immune systems are teetering on the brink. And so the ones, as I should say, particularly the ones that aren't supplementing. And so again, I just want to encourage any of you listening that if you're doing that, you get supplementation in adequately so that you give your body what it needs to help defend you. If you enjoyed tonight's crash course on B12, make sure you check out my playlist of nutritional crash courses.